Oculoplasty is a branch of ophthalmology that specializes in plastic and reconstructive surgery of the eyelids, orbits, the bony cavity that contains the eye, and surrounding structures. The goal of oculoplasty is to improve the function and appearance of the eyes and the surrounding tissues. Oculoplasty procedures include eyelid surgery. This encompasses various procedures, including blepharoplasty, which removes excess skin and fat from the upper or lower eyelids. It also includes procedures for lifting sagging eyebrows and enhancing the appearance of the upper face. Additionally, eyelid malposition surgery corrects issues such as droopy eyelids, ptosis, or eyelids that turn inward, entropion, or outward, ectropion. Orbital surgery. This includes procedures to correct abnormalities of the bony cavity surrounding the eye, such as orbital fractures or tumors. Lacrimal, tear duct, surgery. This includes procedures to correct problems with tear drainage, such as blocked tear ducts. Oculoplasty is a highly specialized field that requires extensive training and experience, as the procedures performed can have a significant impact on a person's vision and appearance. It's important to choose an experienced, qualified oculoplasty specialist for these procedures. Additionally, there are some ocular conditions that are specific to the Eastern population. Blepharoplasty is a condition in which the eyelid skin and muscle fold over the eyelashes on the lower eyelid, causing the lashes to rub against the eye. This can lead to discomfort, irritation, and tearing. Blepharoplasty is most commonly seen in Asian populations and can be congenital or develop later in life. The treatment of blepharoplasty varies depending on the severity of the condition and may include the use of eye drops, ointments, or artificial tears to relieve symptoms. In more severe cases, surgery may be necessary to correct the problem. The surgical procedure, known as blepharoplasty correction, involves repositioning the eyelid skin and muscle so that they no longer fold over the lashes. In Asian eyelid surgery, several unique considerations must be taken into account that are different from Western eyelid surgery. Crease height. Asians typically have a lower eyelid crease than Westerners, and thus the crease height may need to be adjusted differently. Eyelid anatomy. The Asian eyelid has a different anatomy than the Western eyelid, with a thicker and more fibrous eyelid, which can affect the surgical technique used. Cultural preferences. Asians often prefer a more natural appearance and may have specific cultural beauty standards that need to be taken into account during surgery. Epicanthal fold. Many Asians have an epicanthal fold, which can impact the surgical approach used. Skin type. Asian skin is typically thicker and more resilient than Western skin, which can affect the post-operative healing process. It's important to consult with an experienced plastic surgeon to ensure that the best surgical approach is taken for the unique needs and preferences of each individual patient. The tear system is an important part of the eye and helps to maintain the health and comfort of the ocular surface. There are several diseases of the tear system, including dry eye syndrome. This is a condition in which the eyes do not produce enough tears or the quality of tears produced is poor, leading to dryness and discomfort. This can be caused by factors such as aging, medications, environmental conditions, and certain medical conditions. Treatment options include artificial tears, ointments, and special contact lenses, as well as procedures to improve tear production. Epiphora, tearing. This is a condition in which excessive tearing occurs, often as a result of blockage or malfunction of the tear ducts. Treatment options include medications, surgery, and procedures to unblock the tear ducts. Dacryocystitis. This is an infection of the tear sac, which can cause pain, swelling, and redness in the area. Treatment options include antibiotics, warm compresses, and in severe cases, surgery. Blepharitis. This is an inflammation of the eyelids that can cause itching, burning, and redness. Treatment options include warm compresses, lid hygiene, and medications. Meibomian gland dysfunction. This is a condition in which the glands that produce the oily layer of tears become clogged, leading to dry eye symptoms. Treatment options include eyelid massage, warm compresses, and medications. In case of blockage or malfunction of the tear ducts, there are several surgical treatments available, including endoscopic decryocystorhinostomy, endo-DCR, is a minimally invasive surgical procedure used to treat blockage or malfunction of the tear ducts. The procedure is performed using an endoscope, a thin, flexible instrument with a camera and light, which allows the surgeon to visualize the tear duct and surrounding area without making a large incision. During endo-DCR, the surgeon creates a new tear drainage passage between the tear sac and the nose by removing a small piece of bone or soft tissue. A silicone stent or tube may be placed in the new drainage passage to keep it open. Bicondylicular silicone tube intubation is a variation of endo-DCR, in which two silicone tubes are inserted into the tear ducts to help maintain a clear passage for tears to drain. The tubes may be connected, or they may be separate but adjacent to each other. Both endo-DCR and bicondylicular silicone tube intubation have been shown to be effective in treating blockage or malfunction of the tear ducts, with a high success rate in restoring normal tear drainage. The choice of procedure will depend on the specific case and the cause of the blockage or malfunction. Your ophthalmologist or oculoplasty specialist will be able to provide more information and recommend the best treatment option for your individual needs.